Like and subscribe for daily OT brain boosters. Client is being fitted for a wheelchair. The widest point across the hips and thighs is 17 inches, and the distance from the posterior buttocks to the popliteal fossa is 19 inches. Which wheelchair seat dimensions should the therapist recommend? B. 19 inches wide by 17 inches deep. An occupational therapist wants to study how a peer mentoring lunch group affects the social participation of middle school students with disabilities. Therapist plans to use a qualitative research design. Which method of data collection would be best? C. The therapist's field notes and observations of student interactions during lunch. An individual is 3 days after flexor tendon repair of the hand and is wearing a dorsal blocking splint. Occupational therapist is planning an early protected motion program. Which exercise is most appropriate at this stage? B. Passive finger flexion with active finger extension within the splint. Context: early after flexor tendon repair, the tendon must be protected from active pulling, so passive flexion and active extension within the dorsal blocking splint is the safest routine. An occupational therapist is educating new staff in a seating clinic about wheelchair prescription for clients with neurological impairments. Which statement is most accurate for the therapist to include in the training? A. A firm seat surface helps provide postural stability. Context: a firm seat surface gives the client a stable base, which supports pelvic alignment, sitting balance, and functional movement. This is especially important for people with neurological conditions who may have poor trunk control or abnormal tone. During a universal design consultation, an occupational therapist recommends widening interior doorways in a residence to improve access for future wheelchair use. The homeowner wants a width that is more than the minimum requirement, but not unnecessarily expensive. Which width is best? B. 36 inches. Occupational therapist is assessing tactile discrimination in a client with expressive aphasia following a CVA. Client is unable to verbally name common items placed in the unaffected hand. Which is the best way for the therapist to obtain accurate test responses? B. Provide a set of real objects and have the client select the matching item, like, comment, and share. Learned something or nailed it? Follow us to stay OT sharp. You got this.